Hey, what's up guys? JG Physio Coach back with you again. I don't know why I'm spinning around. There we go. So I wanted to quickly talk through a case. I won't go into all the details of it, but this was a young chap. It was actually about a shoulder issue, but when we screened his neck, in sitting, we found that when he went into right side flexion, he got some irritation up in that sort of left upper cervical spine. So one of the next things I did was I got down in supine. So when we do this, and when we did this, the two biggest differences were one, as soon as we go into this supine position, we're eliminating gravity. So a lot of those muscles around the cervical spine will just automatically become active when you're standing upright against gravity. So when you're in a supine position, your head's relaxed. They can genuinely relax off and switch off. Then I was actually testing it passively, side to side, and we found that he had increased range of motion, but most notably is that when we took him down to this size, that he had zero pain whatsoever. That was with passive overpressure as well. So when this happens, it's worthwhile. It's a really good, simple way of starting to differentiate between whether or not you have a genuine mobility problem or whether the problem is stemming from more of a stability motor control deficit. So, for example, limited range of motion is not always what you might assume to be just purely, a muscle restriction or just a pure, plain and simple mobility issue. The way that you would tell, though, is that, or get at least a better idea, is that if somebody has a full passive range where you're taking motor control out of the picture for a second, nothing's actively contracting. If they have full passive range, they've got the range there, because if there was truly a mobility issue, that would be restricted too. If they have full passive range, or at least more than active, and then you test them actively and it's restricted or limited, then you're probably looking at some kind of stability motor control deficit. The same concept can be applied to sort of pain. So if somebody's getting pain actively, we're talking neck here, neck motion actively disappears, vanishes passively. Same as if somebody had a painful arc, when they're abducting their shoulder, they get pain there actively, but you get them to relax the arm off, and then you lift them up, and passively through range they're pain free. Then that again you're dealing with some kind of dysfunction from a stability motor control point of view. So what we did then is I got him back up into sitting. I've got a few of these things I try out with people. They're essentially just cues to create some more stability and motor control around the whole sort of cervicothoracic shoulder girdle region. I mean, just a simple retest to see if it makes any difference. So what we did in this case was we did a banded pull apart, just with a yellow TheraBand. Got him to isometrically hold that end of range position, make sure he was getting some good scap activation, and then repeat the side flexion, and hey, it all came back. Hey presto, pain free when he went down to the side. And so there you go. I did check if he had any particular trigger points or things that needed releasing supine, but honestly I really couldn't find anything. And the more I poked and prodded around and didn't find anything, I thought, well, those two things that I found, actively painful limited, passively supine full range, no pain. In my mind at that point, I was going, I think this is a pointless endeavour trying to look around for, once I've done a quick scan of any trigger points, let's just test out the motor control and see if there's an issue there. So that's that. Then the advantage of that as well is that it gives you a really good sort of justification and rationale for what and direction in what treatment approach you're going to take, I should say. So in his case, we went down the route of then looking at motor control exercises. So that's my little case for today. Hopefully you find that useful. Any questions or anything, feel free to give me a shout.